Well, we're here again with Dr. Martinez, a dentist. Hi, Dr. Martinez. How is life?
Hi, how are you?
Good. Dr. Martinez, I'd like to know from you, about bleaching, teeth bleaching and or teeth whitening, as it is called. And there seems to be, all kinds of ways out there. For instance, I would like you to shed some light on the over-the-counter stuff, which costs sometimes, very little money, and that does seem to have some workability. And the dentist things, and even there are different ways of doing it. Tell us what's the difference and when one would apply one or the other.
Well, the difference is that with the products that we use, they're prescription products that only can be done or prescribed at a dental office because the content of the whitening solution is a little higher percentage that you would get over the counter.
So it's stronger.
Because it's stronger because obviously they assume, and we know that we should, once we prescribe a whitening system for a patient, that the patient will be coming back to be evaluated to see how it's working, to make sure that the gums are not being affected, or that if they are, it's usually a temporary kind of effect. So we usually want to make sure that the patient comes back to see us to make sure that everything is going well, versus a over-the-counter product that can be bought. There are a lot of good ones over-the-counter products, but again, you're going to get, it's kind of like getting, a whitening toothpaste, maybe a little bit stronger than that. So you're not really going to get the full benefit of a prescription product.
So does that mean you never get the full benefit of being white the way you maybe want it? Or is it like, uneven white, or just does it take longer? So let's just say you need to wear this trays forever and ever to make it happening, where in a dental office you have it done and over within a few days or whatever. What's the real outcome there?
Well, the thing is that with the over-the-counter products, you really don't get a full effect of the whitening because of the strength. You don't have the strength of the product as you do with either in-office whitening and one-hour whitening under a light, or you don't have the same strength of the chemical that is used. So that, obviously, let me tell you my philosophy of the whitening products. Mm-hmm. Because whitening is very different. People's enamel determines how they're going to whiten their teeth, how much they're going to whiten, and also patients' expectations. If you have a patient that expects white teeth, you will never get them white teeth, because it really all depends on the consistency and the quality of the enamel the patient has. Mm-hmm. So I always recommend, for instance, if people are going to invest in a 1-hour whitening system from our office, I always recommend that they try out a over-the-counter product, spend a little bit of money there, because that's going to determine if they are people that actually are good candidates for whitening. Excuse me. Some people are just not good candidates, and they will not see any results whatsoever. And those patients usually are not good candidates for whitening because they will not even see results with ours. Plus, the expectations that they have are very important. If they have this extremely white-looking paper white that they want, they're not gonna get it. Nobody really has that quality of enamel, and I have to cough. I'm sorry.
That's all right. So, are you okay?
Yeah, I'm fine.
You need some glass of water there?
No, I'm fine, thank you.
Okay.
So they really are not going to whiten the way they should whiten, and so I always recommend, if they're going to make the investment, and we can't guarantee that investment because we don't know how much they're going to whiten. We can't tell, I know there's shade guides that we could say, we predict that you're going to go this way, but it's kind of like, a prediction.
Right.
We don't know how much they are going to whiten. So,
well, that's very good and straightforward information. It's wonderful. Now tell me, but in your office, for instance, because there are, one can put trays on it from the dentist, supervised, and then that whole glue or whatever you put on there is stronger than the one you get over the counter. But also in the office, you can do the, I guess, laser whitening or whatever you might want to call it. Is that what you do all the time, or you're doing also?
Yes, we have both. We have both systems at the office. Okay, we have the in-office whitening. Some people just want to get in, get out. We want that instant gratification, and I don't blame them. I've tried both systems, and yes, it's very nice. It's kind of like a cosmetic procedure, getting your hair done. You get it done, you're over with in about an hour, hour and a half, and it's done with.
It's a little bit like, sorry to interrupt you, it's a little bit like an adult, especially an adult who, let's say, has a couple, 2, 3 crooked teeth in front, and even though adult orthodontics, Invisalign and stuff would do a wonderful job over 6, 7, 8, 9 months, a guy like me, getting speeding tickets left and right all the time, about a point or two away from losing the license, and that at 58, I probably will say, so can you flap some veneers on it and grind those babies down, flap some veneers on it? Can I be out this afternoon with a good smile? And you would probably say, yes, we can, Helmut. Maybe not one afternoon, but at least a day or two later, and I would go for that. That's a little bit that type of, is it the same scenario, more or less?
Yes, it is. It's, and I would recommend that, for instance, for people that really want that white smile, we can do it with veneers. With whitening systems, we can't. So I always tell people, it depends on what you're looking for. If you're looking for your natural looking white, very nice and straight, we can change that with veneers. Because keep in mind, whitening only changes the shade of the teeth. It does not change the shape or the position of the teeth.
Right,
with
of course.
veneers and lumineers, you can't do that.
Adjust
you can change the position or get the perception that it's a straight tooth, or that the gap, you don't have a gap.
Right.
So,
well, we're talking about whitening now. So let's get back to the whitening thing. Sorry to have sidetracked you with my comment. It's, if you want it fast, go into the 1 or 2 hour treatment, you're out. Otherwise, you have to wear a tray for how long? Usually a month, a week?
it's actually, obviously depending on the system that you use, but with our system, you probably about 14 days, 10 to 14 days, for about 20 minutes a day. You can wear it at any time you want, as long as your teeth are clean, and then you just wear it for 20 minutes, rinse, and then you're done for the day.
Okay, all right. And let me ask you something. Once a person has done a whitening, any whitening for that much, I suppose, and a year, 2 or 3 later, the teeth get stained again. Maybe it's a person who drinks, who likes his cappuccino and espresso and likes a glass of red wine in the evening, whatever it might be. Can he re-whitening them? Can he redo it, or is it something like a bypass where there's only so many you can do?
No, you can re-whiten, and I would actually think or know that it's going to take less than 3 years for the teeth to change shades. I mean, let's be realistic, and I never want to lie to a patient and say, you know what, it's going to be like this forever. It really all depends on home care and habits and professional cleanings. And so but usually the person that has or wants the whitening system usually are people that actually do take care of their teeth and want whiteness and want the whole treatment.
So again, and it's probably a sidetracking now, me, I love doing that, I guess. If a person, as you said, takes care of his teeth, wants to augment his look a certain way with his teeth, which is one of the smartest look type of investment one can do, probably. And they don't say for nothing $1 million smile, and the smile is all and everything. And if he wants that and wants to stay stable, would again be a set of veneer or lumineers for that much, whatever it may be, same thing more or less. Would that again be kind of the way to go on a long run and right away get a even more exact, beautiful smile and then keep it? Because lumineers or veneers, they wouldn't stain anymore, or would they? Am I wrong there?
No, they should not stain. Although you need, just like any dental work, you need to be very, very diligent with your home care and professional cleanings. And actually, lumineers per se are guaranteed as long as for 3 to 5 years, as long as you are coming to your appointments every 6 months for your regular cleaning.
What I love about you, Dr. Martinez, is that you're really not embellishing things. You just you say, look, yes, this is a good thing, but you need to do your job here, baby, because otherwise the whole thing is going to fall apart again and blah, blah, blah. And most of us in almost all parts of lives, we're so used to get everything made, to live in a throwaway society, to kind of not participate in things. I know, I call myself an active and I'm out there being so to say, not a bystander type of person, but I can tell you, just talking to my wife, how many things apparently I just don't do what it takes to do on my part and want to rely on whatever else is out there, technology, name it. And you're bringing it really home to the patients that, this is personal care. I mean, yes, the dentist is there to help, but boy, if you don't participate, and I think this is very important for people. I know I talked to you in other areas about their periodontal disease and stuff, and I think one of the biggest advantage a patient gets coming to your office is that he really gets it the way it is. Thank you very much, Dr. Martinez.
Thank you very much.